Good evening. I'm Dr. Sarita here. Today's session, we will discuss about what is edema. Edema, it causes, how does it present, what are the treatment options, etc. What is edema? Edema is nothing but swelling, swelling anywhere. Most of the time, commonly, we see swelling, people complaining of swelling in the lower limbs, which we call it as a leg edema. And leg edema, how do we know? I mean, they only feel that, oh, it's swelling in the morning and they are swelling in the evening as they're standing towards the end of the day. Or they also at times complain of swelling in their face, which is around their eyes. And some people may have problem with any medication that they have taken and some allergy coming up, because of which they have swelling, itching all over the body, and then they develop swelling all over the body at times. And sometimes maybe a bee or a bug has bitten them, or even a mosquito. You have a small amount of swelling that is coming up. So basically, swelling is nothing. I mean, swelling is called as an edema, and small insect bite swelling is not. We don't call it as an edema per se. Only when it is in the legs or thing there we call it swelling. There are words such as pulmonary edema and all, which will come to later. First, let me talk about the swelling in the legs. The most common complaint. So the swelling, how do we detect? Is the patient will say it is swollen. When we feel as doctors touch over the bone, apply a little bit of a pressure, then we see a dimple coming up. So that means that there is a swelling. Swelling is because of the fluid accumulation in that area. So if you're talking about the leg swelling, the most common causes for the leg swelling are either the patient is having low albumin because of the nutrition status that they're not eating very well for a variety of reasons, because of which the blood albumin is low, and then they develop swelling in the feet to begin with. Some people with a kidney failure, they because the kidney is unable to put out the extra fluid from their body, then they develop swelling. Sometimes people with a liver problem, wherein there is a congestion of the liver, because of which they develop a swelling in the body. Or heart failure. When the heart is unable to pump very well, there is a back pressure, and then you see swelling in the feet. So these are the most common causes of leg swelling. Very rarely, we also have swellings because of the venous, like local causes in that leg. If it is only in one leg, we think of the local causes. And those can be like a filarial leg. It could be venous thrombosis in that leg, because of which there is no return of the blood from the leg to the heart area, which is causing a venous pressure. So these are the common causes of the leg swelling, which edema we talk about. The second type of a swelling that or edema that we talk about is the pulmonary edema, meaning fluid inside the lungs because of either a heart failure or because of the kidney failure, wherein the fluid accumulation happens, like dialysis patients. They're unable to put out the fluid from their body, and whatever they have taken has accumulated, and that also causes a fluid overloading status. The heart goes into a failure. Finally, you have fluid in the lung. So this is called as a pulmonary edema. Okay. So what are the other types of edema that we can talk about? The other type of edema we can even say is cerebral edema, for that matter, meaning swelling in the brain. That is called as a cerebral edema. Where do you get cerebral edema? Whenever there is an electrolyte imbalances, especially today's day, low sodium has become a very common thing among the elderly patients who are on some diuretics and also are hypertensive. So we are asking them not to take too much of a salt. At the same time, they're taking more water and not taking good intake. Such people develop electrolyte imbalances, which will contribute to the swelling in the brain. Sometimes even after the stroke, there is a circulation problems to the brain, and around the area wherein there is an infarct, some people develop edema, and that is also a type of a cerebral edema. Other than these two, we can talk about a macular edema. Macular edema meaning swelling inside the eye, in the macula. This is because of the blood vessels leaking into the retinal blood vessels leaking, we get the macular edema. It is also in a way to say that the pressure in the brain is a little bit higher. Okay, so these are the types of edema depending on the site wherein we have the accumulation of the swelling happening. Only in the leg we normally are able to elicit the thing. Pulmonary edema, we examine it with a stethoscope. We patients do complain of breathlessness. They do have cough. They bring out a sputum which is pinkish in color. And on a stethoscope, when we put and examine, we hear some crepitations. We hear some wheezing. So then we call it as a pulmonary edema. Cerebral edema is usually when my patients are usually lethargic, sometimes they're irritable, they complain of a headache, they may have some visual disturbances, and they become a little bit, level of consciousness decreases. So these are the signs of the brain edema. How do we know that? Usually, when we check out the electrolytes, we suspect that. And stroke for the stroke and other things, the CT scan that we do will help us in finding out if there is a stroke and there is a peri-ischemic area swelling that is happening, things like that. And if the macular edema is with retinal, with a retinoscopy, we'll be able to identify whether the patient is having a retinal edema or not. Now, knowing that there are different parts of the body where the fluid accumulation happen, and because of that, we label it as the edema. And the diagnosis ways I have mentioned. So now, how do we treat that? Treating options are basically on the reasons or the cause of that swelling, right? So whenever if it is the pedal edema that is very very common, the first thing that we try. I mean, in the pedal edema, we also there is another condition wherein there is swelling that you can see obviously, but when we put and pressure and see, there is no dip that is coming up. That tells us that it is not a fluid accumulation, but it is a different type. Like, for example, a thyroid, hypothyroid patients with a myxedema or patients with filarial thing, they do develop swelling which is not pitting. So that is a different type of swelling that we can encounter. So again, treatment is based on if you think it's a filariasis, it is an anti-filarial treatment that we do. If it is a venous thrombosis, which is diagnosed by a Doppler, then we treat that with the blood thinning agents. And if it and also look for the reasons why did that person develop a venous thrombus and then treat it accordingly. If it is a pitting edema, then we look into is a heart failure that is causing it. Usually, we see the raised JVP or a fluid level that is higher, liver that is a little bit tender, or having a ascitic type of a picture that means protrude abdomen and all. Or if they have a kidney problem, which is on a blood testing that we get to know, like a urea creatinine that is elevated or LFT that is deranged. These are the ones that gives us a clue to find out the reason for that. So if it is a local, then normally, like again, it is a swelling because of the lymph node enlargement or local infection, then the lymph nodes in that area will be enlarged, and we can suspect some local infection because of which they have developed the swelling, and that is usually unilateral. Lung edema, pulmonary edema, majority of the times it is either because of the heart failure, whether it's a right heart or a left heart failure. So we normally look at the ECG, echocardiogram, and we also majority of the times are able to detect that it is the muscle that is not able to cope. So ejection fractions are less, and we treat that with some diuretics as with the fluid containing medications and also medicines to improve the function of the heart. Okay, there are certain medications also that can give you the swelling in the body, like blood pressure medications. These BP medications can, like calcium channel blockers, amlodipine, cilindipine. These things can cause, they lower the blood pressure by dilating the blood vessels. So whenever a person is sitting for a little longer period of time, this pooling of the blood happens in the feet, and that causes swelling in the feet. So it can be because of the medication, or it can be because of the pathology per se. Okay, so heart, as I told you, the heart is treated with diuretics and hypertensive medication, anginal medications, stuff like that. When it comes to the cerebral edema, the way we treat it is by looking at the cause. Is it because of a stroke? Then it's just anti-stroke measurements. If it is because of electrolyte issues, we correct the electrolytes like hyponatremia, which is very common. First and foremost, we stop the diuretics and then we give the medications like 3% saline to slowly and gradually raise the sodium level to a safer level, which will reduce the cerebral edema. So the level of the consciousness starts improving, headaches comes down, and the patient starts feeling better. Macular edema, of course, usually it is again because of the bleeding. Usually, the eye specialist will come and check it out and see if there's any, if it's a hypertension that is causing it, we lower the hypertension. If there's a bleed, they use laser techniques to cauterize the blood vessels so the bleeding doesn't increase, and the vision that is not getting affected. There is very few benign conditions wherein there is a naturally, normally some amount of fluid is accumulating in the body, and such conditions are like in a pregnant lady, for example, wherein the uterus is applying pressure, the growing uterus is applying pressure on the inferior vena cava, and some amount of swelling can be there in the lower extremities, which goes away after the delivery of the baby, and the pressure is relieved. Some conditions, like for example, if a person is premenstrual, some people have the PMS syndrome, we call it, wherein because of the hormones which dilate the blood vessels, there is a certain accumulation of the fluid in the body before menstrual cycle. And as a menstrual cycle starts, the fluid gets out of the body and the edema gets off. So very few people come up with these complaints, and these are natural and they are due to the hormones, and they get better as the episode is done. Regarding the local swelling because of the insect bite or something like that, that can naturally be it is self-limiting condition. We don't really need to treat that problem unless it's like a food intake and that is causing an allergy, and anti-allergic medicines have to be given. So I think that's what we can talk about in swelling. And depending on the cause is the treatment. So treatment is most important to treat any edema is to know exactly what is the reason that is causing the swelling, and which depending on the area we get certain clues what could be the reasons, and we look into that. This is how we treat the edema. Thank you.